How does CSF help differentiate MS from similar illnesses? Imagine trying to solve a medical puzzle where each piece reveals a bit more about what's really going on inside the nervous system. Cerebrospinal fluid, or CSF, is like a window into that hidden world. When doctors suspect multiple sclerosis, analyzing CSF can provide crucial clues to distinguish it from other neurological conditions that have similar symptoms. One of the most important markers in CSF for diagnosing multiple sclerosis is the presence of oligoclonal bands. These are unique immunoglobulin G bands that appear in the CSF but are not found in the blood serum. Their presence indicates that the immune system is actively producing antibodies within the central nervous system. In fact, most people with multiple sclerosis have positive oligoclonal bands, making this a key feature in diagnosis. The 2017 revised McDonald criteria include the detection of 2 or more oligoclonal bands as part of the diagnostic process. If these bands are absent, it suggests that other conditions might be responsible for the symptoms. In addition to oligoclonal bands, scientists have identified another helpful biomarker called Kappa-free light chains. These are small pieces of immunoglobulin that also reflected immune activity within the central nervous system. Elevated levels of Kappa-free light chains in CSF have shown high sensitivity for multiple sclerosis, meaning they can support the diagnosis when combined with other findings. Using both oligoclonal bands and Kappa-free light chains together can improve confidence in diagnosis, especially when MRI results are inconclusive. CSF analysis also plays a role in ruling out other illnesses that can look like multiple sclerosis. Typically, CSF in MS patients is clear and colorless, with only mild or no increases in cell counts and protein levels. This is different from infections or inflammatory diseases, which often cause more noticeable abnormalities in CSF, such as higher cell counts or cloudy appearance. By examining these factors, doctors can narrow down the possibilities. However, it's important to remember that positive oligoclonal bands and elevated immunoglobulin production are not exclusive to multiple sclerosis. They can also be seen in other neurological disorders like infections, inflammatory diseases, or even some cancers affecting the nervous system. That's why CSF results are always interpreted alongside other diagnostic tools, such as magnetic resonance imaging scans and clinical evaluations. In summary, analyzing cerebrospinal fluid helps differentiate multiple sclerosis from similar illnesses, mainly through detecting oligoclonal bands and elevated Kappa-free light chains, which suggest immune activity confined to the central nervous system. When these findings are absent, it points toward other diagnoses. Combining CSF analysis with MRI scans and clinical symptoms provides a comprehensive picture that guides accurate diagnosis and early treatment planning. If you or someone you know is undergoing evaluation for multiple sclerosis, consulting a healthcare professional is essential to interpret these results properly and determine the best course of action.